Hello and welcome to the Combinations podcast, the podcast from North Staffordshire Combined Healthcare NHS Trust. And today on the podcast, we're going to do a deep dive insight to one of the teams at North Combined, and that is the clinical audit team. I'm Kyle, the digital content lead from North Staffordshire Combined, and today we are talking a clinical audit. So without further ado, let's introduce the guests on the podcast.
Okay, so my name's Karina Bentley. I'm the Clinical Audit Manager for the Trust.
Hi, my name's Kate Arrowsmith. I'm Clinical Auditor at the Trust.
Hi, I'm Debbie Scragg. I'm Memory Services Manager and Care Home Liaison Team Manager for Combined Healthcare.
I'm Jackie Powell. I'm a Clinical Lead. I work with the Early Intervention Service.
Hi, I'm Simon Wilson. I'm a Senior Service Manager working in the Community Directorate and had a service lead responsibility for early intervention psychosis in North Staffordshire.
So, hello and welcome to the Combinations podcast, and it's great to have you all here today talking about clinical audit and the world of auditing in, I guess, the NHS. Can one of you just explain what exactly is clinical audit and what the purpose of it is? Because we're going to have new listeners that are never going to have probably heard of clinical audit. So if you could just tell us what it is.
Yeah, so clinical audit is a quality improvement process, and we use it to improve patient care and outcomes in NHS services. We have national audits and local audits, and what audit involves is looking at patient care against standards to identify the gap between best practice and actual practice. So we'll have standards and criteria that we're supposed to be meeting. We'll look at how we're performing against those standards and then analyse that data, develop action plans to address any of those gaps, and then hopefully come back and re-audit in a few months' time and see that those actions have had an impact. And in that way, we hope to improve patient care. Kate, would you like to speak a bit more about the work of the department?
Yeah, so audit deals with a variety of different topics. We offer a variety of different levels of support to different clinicians as and when they need it. Just to give you an idea of the breadth of work that we're included in, if I take you from the top, so as Karina mentioned, the national audits. So these are mandatory audits for the Trust. We're involved in all aspects of the audit cycle here, including sampling, data collection, data submission and action planning. These are really important audits for the Trust as they provide us a benchmarking report. So what these do is provide us with the findings for the Trust so we can see where we're performing well and where there's potentially areas for improvement. But also because they benchmark us nationally, we're able to see how we're performing against other providers. So it allows us to see nationally how the NHS is performing in mental health, but also specifically how we're comparing it within that. On the national level as well, myself and Karina lead on Sequins. So Sequins stands for the Commissioning for Quality and Innovation Framework. So this is something which supports improvements in the quality of services across the Trust and the creation of new and improved patterns of care. So the Sequins are annual for the Trust, and we get set compliance targets. So we have to submit data at the end of each quarter. And usually progressively as we work through the year, our performance and our compliance goes up, which is really positive. Just to give you an idea of the sorts of topics and how varied these can be year on year, we've got 3 strands of topics this year. Firstly, we've got the flu vaccination programme. Secondly, we've got routine outcome monitoring. So this is for community, CYP and perinatal services. And then lastly, we've got reducing the need for restricted practice. So this is within our CYP and our older persons and adult settings. Moving away from the national audits, we're also heavily involved in local audits, specifically the Directorate Priority Audits. So these, with these audits, we're involved in the complete full audit cycle. So we're involved in anything from the methodology and the sampling from the beginning through to data collection, data analysis and action planning with the relevant teams and services. Moving further down the ladder, we then deal with clinician interest audits. So these are specific individuals or small groups of clinicians who are interested in specific niche audits that are relevant to them. And the service that we provide here is we can either help with the full audit cycle, or you can just give us a shout at different points. So that might be some clinicians need a hand with methodology, or some clinicians might just need a hand with data collection. So we offer whichever sort of service is required to the individuals at the time. So yeah, hopefully that gives you an idea of the sort of breadth that we cover in the team.
Certainly gives us there was a long list of things that got undercovers from audit. You said national. So does every NHS trust have an audit team or a clinical audit team inside?
As far as I understand it, we do. As I mentioned, clinical audit is a quality improvement process, and there is also a separate process of quality improvement, which is more about continuous quality improvement. Some trusts have a quality improvement team, which covers that and clinical audit, and sometimes quality assurance and research and other things as well. Other trusts like ours have a specific clinical audit team, and our clinical audit team is fairly compact. It's myself and my colleague Kate, and we sit within the wider governance department, which also oversees things like risk management, quality assurance and freedom of information requests. So we work really very much in that sort of assurance and quality improvement side of things within the trust.
I was going to ask how many are in the team at the North Staffordshire Combined audit team, but as you mentioned, there's 2 of you, so that's quite a small team for I wouldn't say a big trust, but for that's a lot, there's a lot of members of staff at our trust, so there's a big I guess a remit that you cover. I'd like to invite the other guests from the podcast to just tell us how you've been involved in audit and how you found it.
So I've been involved with Combined Healthcare's clinical audit team, mainly Karina, with a number of audits over the years, which I believe influences the quality improvements made within our services over time. Not everyone's aware of our audit team. I think they work very hard and sit there in the background sometimes. But actually the work that they do does impact on our standards greatly in what we're doing. And for myself, I've learned so much about the process of undertaking an audit correctly, some of the efficacy around auditing, including criteria, protection of data and methods, and further to this understanding, both local and national, and drivers for this and providing evidence of good practice. So for me and my service in memory services, we last took part in a national audit of dementia, and this was set by the Royal College of Psychiatry on behalf of NHS England. And this was a quality improvement partnership. So the last one we did was in 2021, and our audit comprised of an organisational tool, a case note, audit as a sample. We measured against national averages and feedback from patient and carers. We've also looked at a number of areas in our pathway, the wait times, the impact of that, and our offer of assessment within that of people coming into our services and memory concerns. And from the audit, we have made a number of improvements as well. So I've been fortunate to work with Karina, and as part of the national audit of dementia, we also got involved in the actual audit for auditing of the national audit of dementia, which was good fun. So we had an away day looking at the audit that we use, and then me and Karina came away and sampled that as well. So that was good fun, and it was good that actually they were listening to us from working through a COVID and the changes and the impact on our services, and us being involved in how that audit looked, taking into account some of those changes and working in newer ways as well. So for me, being involved in clinical audit, it's actually rewarding, it's challenging, it takes some time, it's getting the process right. It's like a good book. When you pick it up, you can't put it down, you have to keep going back to it, and if you don't, you'll have the audit team contacting you anyway. But it's good to come back to. It's good to rate against the findings and areas to improve, and actually areas that we do well in as well. And also, I think, to an outcome of an audit tool, whilst not everybody may get involved in the process, although I would encourage you if you can, I think people do like to hear the outcomes of audits as well, and what that means for those. So, and on a personal level, it's helped my professional development and gets me thinking about practice. And I think I'm lucky to work with a really good audit team within combined healthcare.
And that's what we like to hear, because it sounds like the audit team are just an extra boost to productivity and making the ways of working just that much better.
Yeah, definitely. I think from my perspective, it's good to be involved in audit, and I guess we've been, over the last 5 to 6 years, we've been involved in the National Audit of Psychosis, and the NCAP audit has really helped us to understand how we're performing as a service and where we can improve. I know of other services actually that don't have an audit department across the West Midlands, and a lot of that data collection, a lot of that work is captured by the teams and actually is quite a burden. I've got to say that Karina and Kate and the audit department have been integral in our sort of quality improvement journey. They've been a real part of helping us understand what we do, how we do it, how we measure it, and how we can start to improve things. And they're very close to the data, and we really support us in understanding our data and how we can work differently to improve what we do. So it's following that cycle round. And I think this is what the national audit does year on year. You know, you get your results and you develop this action plan that helps you to think, okay, these are the areas that we need to improve upon, and then you're measured year on year. And I've got to say, our journey in early intervention has meant that we've moved from a level 2 up to a level 4, which is an incredible journey and an incredible reflection of the work that's been done within the early intervention. Jackie has been our audit lead in the service and has again really helped and worked very closely with Karina to support that journey and to support that journey of improvement.
Yeah,
And
absolutely. And it's having that link, I think, to the data and seeing the value of using data to improve your service. And I suppose because the national NCAP audit has been running into its 6th year now, we've seen the impact that if you use that data properly, then you really can make a massive difference on the quality of the service you're providing. And to go from a level 2, which is a requires improvement standard, to what we are now, which is a level 4 top performing service, that's something that we're really proud of. And we couldn't have got there without the support of Karina and Kate and helping us to use that data and build on it.
And is it good to have the clinical audit team come into your teams and sort of give you a perspective that you probably wouldn't see working in that service?
Absolutely, yeah. I mean, I think for us, sometimes as clinicians, it's hard to see the detail in the data and pick up the themes and identify how we can use that. And what Karina does is she helps us to see that really and to formulate that together into an action plan and help us to prioritise what are we going to focus on first, what's achievable, what do we need to do to try and do that. So yeah, really helpful.
Yeah,
that's what. Yeah, like I say, that's helpful for us too as well. So working on the audit and the feedback from the audit and the action plan has helped us to look at roles within our service. And in some areas we've developed roles actually to target some of the wait times or where the pressures are within our memory pathway. So it's been really helpful for us to evaluate that and to look at what we need within our service and planning.
Yeah, I think we've sometimes it's difficult to do, and sometimes the information isn't always easily accessible. And what Karina does really well is actually she does outreach into services, and she'll come and interview our care coordinators, and there's all means possible to get to the information that's required, I guess, to ensure that we're getting the data that is reflective of the service we offer. So it's not, I think audit perhaps can sometimes appear a little bit cold or a little bit distant, but it's certainly for early intervention has been an integrated and integral process where really Karina's an extended part of our team and supports the team in a way that we find really helpful.
she's like that caring friend that comes in and makes all the difference. Just
Well,
acts of kindness here and there.
well, she does point out when something's missing.
Because obviously you say that it can be cold, like the word, like the audit. When you think of audit, it's not something you think, oh, that's going to be really good for the team. But obviously audit, it's about, you know, finding the data, making the change. But if a team's listening and they're like wondering, well, actually, you know, audit could change us, but they're worried that it's a bit corporate, it's a bit like, oh, they're going to tell us what to do. What are the positives and what are the benefits to having an audit, and what makes it, you know, makes Karina part of the team?
For me, I think it's sorry, who wants to go? I think for me, I think it's about understanding why are we doing this audit? What's driving it? What's the purpose? And if you can connect to that, then you've got the buy-in, and then the team are interested and the team want to get involved, and then it becomes integral and part of what you do. So for the NCAP audit, the aim of that audit is to improve the quality of services for people experiencing the first episode of psychosis. And we know from data and literature from years ago that the outcomes for that group of people were not so good previously. And then with the introduction of early intervention services and the NCAP audit, we've seen across the country an improvement on services that are delivered to people. So I think if you can connect with that and see the passion, and we're all driven by that. That's why we come to work every day. And we can see that the team will buy into that. And obviously Karina wants to see us improve, and she connects to that too. So then it all becomes a project that you're all working on together.
I think most clinicians are inquisitive. They want to understand what they're doing, what has the biggest impact, and ask questions about how they deliver care and how they can improve care. So although some of these things are mandated, I think that's the other area that they bring, that the directorates can work and identify, you know, questions about how are we doing, is this effective, is this not effective, how are things working, and they, you know, Karina helps and Kate helps us to get the methodology right, ask the right questions, and collect the information in a way that's going to support an improvement in services, which is really, you know, the heart of what it's all about.
Yeah, I think I'll just bring out alongside that, as Kate mentioned, we've got local and national audits, and both the audits that the teams have mentioned today are national ones, which we're mandated to participate in. But we also do a lot of local audits, which, as Simon's mentioned, are designed by the directorates or by individual clinicians. And again, that can be a really positive opportunity for teams, that you can choose what your priority is, what are the things you want to look into, and we can help support you with that as well.
And you say local audits. So from what I'm hearing and understanding, audit from today is like the local audits are in our trust. They're what we set, and they're what make our teams and boards and all the areas work a bit more effectively. And are the national ones more compared to other NHS national statistics and data to improve not just our trust but every trust in a way that can make them more efficient and effective and better places to work?
Exactly. So locally, which is what we call our internal audits, it's just us doing them effectively. It's just combined healthcare, although another trusts will have their own local audit programs. But then national audits will be mandated or will come out every year or so. And they've got sort of two objectives, really. So yes, it's to improve the picture nationally and to show growth nationally, but we also do get individual trust reports. So alongside the national report, which will say about the change in, for example, EI services or the change in memory assessment services, we'll also get a local report that shows how our service is changing and improving. So it just adds that extra dimension to it.
And is audit very similar to how like the CQC work with their ratings? Because you mentioned earlier about like there's 4 categories essentially. Is it when you do an audit that you sort of can rate a team, and that's something to work on, and you give them those bits of information to say, if you do this, you do that, and you put that in place, you'll go from a 2-rated team to a better rated service/team?
Not so much. That was really specific to the EI audit. So the way that that's always been organised, the National Clinical Audit of Psychosis, is that they've always had these benchmark levels that they've published, and that's something that the Royal College of Psychiatrists, who organise it nationally, have decided to do. Whereas other national audits don't do that. For example, the Memory Services one doesn't do that. But audit can fit into other accreditation work they're doing. So, for example, I know Memory Services have recently been going through an accreditation exercise, and audit forms part of that work. And then internally, we don't accredit services as such, but we work very closely with Lydia, who's the quality improvement and assurance manager. She sits within the wider governance team as well, and it's all about how all those pieces of information fit together, really, to give us a picture of what our services are doing.
And we've talked obviously the positives of audit, and we talked about how good our team is at North Staffordshire Combined. But what challenges have we faced? What have we come across as barriers, and how have we overcome them? What can we say about that?
I think sometimes the challenges are the time it can take and meeting the timelines for undertaking an audit, and staff involvement. That can sometimes be a challenge, and sometimes it's just a bit of a challenge to get going with an audit. But I think once you get going and you're in it, it's much easier to follow through.
I guess we've been in a process of around sequins, which obviously we work with our commissioners to identify areas that could be improved and how we monitor that. And they do have a financial implication actually around how the trust is paid. I think sometimes one of the challenges is to get the level of data and how data is collected in a way that supports service delivery, because if you disconnect what you want to do from the actual process of being a clinician, what you can do is add in extra bits of data collection that add an extra piece of work that, unintentionally, there's a secondary consequence of actually people start having to, this is where audit gets a bad name, but tick boxes, fill in other pieces of paperwork. It becomes an industry in itself. So I think when we're designing audits and when we're looking at how we collect data, it's trying to be mindful of integrating the data collection in with the systems and processes that we use, rather than adding on a separate piece of data collection, which then staff, this is where audit sometimes occasionally gets a bad name. They get a new piece of paper to tick or something else to fill in, which causes concern or increases workload. So I think that's where we just have to be mindful in how we work with commissioners and work internally to ensure that it fits in with clinical processes. And so they're some of the challenges that we do creatively work with the audit department to make sure we don't, we try and avoid additional work in the audit process if we can.
I think from a clinical audit team perspective, that's interesting what Simon's saying about that data and that recording. And I think when Jackie was mentioning earlier around perhaps some of the work we've been doing in terms of meeting with care coordinators, and actually I found that as the audit's gone on, we've needed to do that less and less. Yes. Because the recording that they're doing has got better and better, and that hasn't necessarily been about asking them to do anything different or new. It's more about making what they're recording being qualitative and about them actually thinking about what it is that they need to put down. So I think that's actually been sort of a side effect, but possibly a beneficial one of the audit.
Yeah, definitely.
And I think that's certainly somewhere that we like to go, and we like to link in as well with, say, our performance team. We're working with Jackie and the team at the moment on some dashboards with the performance team, so that some of this stuff can be directly pulled from our electronic systems rather than it requiring that extra effort to go in and audit the work. So wherever we can sort of reduce that time, then we do our best to do so.
I guess we should give a shout out to Tom and the team that we have in early intervention. We have developed a business intelligence tool, a BI tool that's partly driven around the information that we capture through the NCAP audit, which really does support some of Karina's work, and is again another innovation over the last couple of years that has allowed us to access information in a far more straightforward and accessible way, and also it gives us that assurance or not, depends on what the information is, or at least it helps us to identify areas for improvement as well. And so making information accessible using things like BI tools are certainly, I think, a part of the future of audit and how we work.
Could you just explain what a BI tool is?
The business intelligence tool is a dashboard. It's dashboard driven, so it collects, certainly for the NCAP audit, it's data that's directly captured from the electronic patient record, Lorenzo, into a data warehouse, extracted into a tool that allows us to interrogate that information in a way that helps us to understand. So, for instance, we have certain markers to hit around the NCAP audit where certain percentages of intervention will either score a level 2, a level 3, or a level 4. So what the BI tool does for us is actually draws all the information out, benchmarks it against the national guidance, and tells us where we are in relation to achieving that standard. So we can see at the touch of a button how we're performing and where we're at.
And how is it displayed to yourselves? Like, is it in pie charts, graphs, numbers, colours? Is it something pretty to look at?
Oh, it's very pretty. It's an interactive dashboard and tool, so you can interrogate it. You can set the parameters, and it will give you the information that you need.
Because I think that's what it is important with. You've mentioned obviously with one of the challenges, or Karina mentioned it, or I think all of you have touched on it, is you're collecting data. It's an extra box to fill in. It's a bit more information. It's showing that actually filling that in can then be visually represented to not just the team, but the board, the trust, and that's how things get moving. If things are problems or anything like that, they can look at the data and go, actually, look at this, and they can compare it. And I think that's what's important about audit, is actually having that information that's easy to read, and backed up by the national and local statistics.
Yeah, so performance has been great in terms of supporting that work that they're doing through their data warehouse, and we've also got a system within audit that allows us to do something similar for audits that aren't perhaps coming through in that easily extractable way, where we can create dashboards that are similar to those too. So that's something we're going to be looking to roll out more widely over the coming months.
And it's great that it connects to Lorenzo with the BI tool, because obviously it's coming straight from our source of information. What's the next steps for involvement with audit?
Well, certainly in terms of centrally, we've got numerous exciting things, I think, coming down the pipeline. Obviously, we want to get as much clinician involvement in clinical audit, and we're doing a lot of work within the team in promoting clinical audit in events like today, and also the recent Inspiring Combined event, which we participated in alongside our research and QI colleagues, and that was really positive. And I think the more clinicians we can get involved in audit and excited about it, the better. I'd also like to see us getting some more patient and public involvement in clinical audit, because I'm conscious that that's something that's been quite hard not to implement, not just in our trust, but it's something that trusts generally aren't very successful in doing. And I think if we can look at ways of involving all our stakeholders more in audit, that would be really positive.
Yeah, we're in discussions, I think, again, thinking about how we collect and store data. Obviously, there's outside of the audit department, there's a lot of assurance that's needed within teams and for CQC around how we collect information. So, fridge temperatures or cleanliness or whatever it is, there's lots of information being collected on a daily basis within teams to provide that assurance of quality. I think there's probably room for us to start thinking a bit more about how we use technology and how we aggregate and store that data and how we analyze that data. So for me, one of the things I am thinking about is how we start to use technology in a different way to support audit and data collection, to give us those assurances around quality care and the quality of what we do. So I think that's potentially something that we'll be talking to Karina and performance and thinking about how we develop services in the future.
And I believe, obviously, I've got a very big background in digital. So when you mention digital, it's like, well, yeah, of course, because that collects data without even needing to be asked sometimes. But is it going to get easier to do more audits as we get more technical in the NHS?
Hopefully. I mean, apologies. I think there's always a level of qualitative interrogation that needs to put people, and that's, I think, some of the work that Simon and the team have been doing with performance, and that we're trying to do around a lot of our other audit work, is looking at what are the things that actually are just kind of yes, no, straightforward. Has this person had a care review meeting in the past 12 months? That's an easy yes no question, and should be extractable data. When you get more into the actual quality of okay, well, what did that meeting involve? How was the person involved in that meeting? Was it qualitative? That's really where audit can really focus in, because that's where you do need that sort of person to come and scan that, because I think we're a long way off AI or digital being able to do that in any really qualitative way.
You say we're a long way off, but I'm not too sure that AI would agree with that. I'm sure it'll be hopefully assisting us more very soon. How can we encourage others to get involved with audit? Because obviously you guys are very positive about audit. I know we've got the audit team here, but how can we get more teams and more services involved?
I think for me, it's useful just for everyone to know that we are here, we are able to help. Some people will be more confident in conducting their own audits, so they might just need a little bit of assistance from us in terms of pulling a sample, for example, or just a little bit of an idea of previous audits that have been conducted on similar topics, whereas some people might need full-on help from us if you've never conducted an audit before. But we're friendly people, we're more than happy to help. We love auditing, so if people just contact us, we can take you through the simple step by step, and we can collect the data with you, we can analyse it for you, we can help in action planning meetings. We've done it all before, so we're more than comfortable to help people.
I think it fits in with the quality improvement cycle and the work, a lot of the QI work that's being done across the organisation. It's almost integral to some of that. So I think being supportive of teams to be inquisitive about how effective they are and what they do, what they want to change, how could things improve. I think as teams engage with that and start to ask the questions, then it's working with our QI leads and working with audit to start to generate the methodology that helps us to understand what we want to change and how we measure that. And I think that's what audit does really well, is it does help us to say and demonstrate measurable changes and measurable improvements, and also to celebrate that when we achieve that. So yeah, I think it's all part of that journey to improving services, really.
And I think it is important. You mentioned celebrate. It is important to celebrate the progress that they make from an audit as well, because it's a change. It's something that's going to make everything much better. And I think that's something that having an audit will allow you to do as a service or a team, is just to celebrate. Wow, look at this. We've made an improvement.
Although it takes a bit of time to be involved, I think being involved and having the outcomes of audits and action plans and improving practice, you actually end up becoming much more efficient and look at the ways that you work. So you would in the end save some time, because as Simon and Jackie have talked about, the BI actually being able to get that information that quickly, as an outcome from doing a clinical audit, is I'm listening very interested myself to this, because it would save time on rooting around for information. So it is working together, and the more people that are involved in audit and overcoming that fear of audit, or what audit means to them, is a better way of working.
I was just going to say, I have to say as well that I think probably our best advert for audit is people like Jackie and Simon and Deb, who've really embraced it and really sort of taken it forward with their teams, and really sort of thrown themselves into it, because to have clinicians saying how it's helped them is a much better advert than anything we can provide. So that's brilliant.
And that's why it's important to show an insight on this Combinations podcast to the audit team, because, you know, this is background workings of the NHS that not everybody sees. Even, you know, us in communications, we don't really hear much of the audit team. We probably see some of the results and some of the success stories, but we don't see the little workings of how the team has the impact on the trust.
Yeah, they're definitely there in the background, aren't you, doing it? I mean, if I was giving advice to other teams, I would say be brave, really. Don't be frightened of audit. If you do, if you grasp it, it'll become your friend, and it's a tool to improve quality. It helps you see what's important to you and where you want to go as a team and as a service. So I would definitely advocate getting involved in audits, and definitely involving our audit team, because they help you climb up that mountain, really, and you're not going to fail if you've got them by your side.
Yeah, definitely.
Brilliant. That's what we like to hear. I think we'll wrap it up for the podcast today, unless if any of you have got anything else you'd like to just say before we finish the podcast about clinical audit.
No, I think I'd just really like to thank everybody for coming and supporting audit. It's been brilliant to hear such enthusiasm from our clinical colleagues, and obviously from Kate as well. And if anybody wants to get involved, we've got a page on CAT. We can be contacted on the Outlook or via Teams as well. Please do approach us. We're, as Kate says, we're quite friendly, so please do get in touch.
Brilliant. Well, thank you all for coming on the podcast today and sharing your insight to audit. And I hope you've enjoyed the time on the podcast.
Thank you.
Thank you.
Brilliant.
Thank you.
Bye.